Good morning, everybody. It's so nice to see you. I have never lectured in a church before. It's kind of blowing my mind. All right, so today we're going to talk about SIBO, small intestinal bacterial overgrowth. We're going to talk about intestinal and methanogen overgrowth and all kinds of other things that can cause symptoms that are pretty common. There's a new thing, sort of a new thing. So sometimes the symptoms are not caused by bacteria, they're caused by this archaea. So if you like to be really specific, this organism, the Methanobrevibacter smithii, is not bacteria. It's from like a previous thing that occurred evolutionarily before bacteria came to be. So anatomical structures or changes in the body also can make SIBO more likely. So ileocecal valve is supposed to keep stuff from going from the colon back up into the small intestine, from going backwards. Sometimes people have that removed from surgery. So different types of resection surgery in people that have Crohn's disease, for example, can sometimes take out the ileocecal valve and put people at an increased risk. So the question was how often to repeat the test. I really favor testing for SIBO. Some people will come and they're like, I'm sure I have it, here's my symptoms, and I'm like, yeah, you probably do, but I really like to test because if you don't know what organisms are overgrown, it's a little harder to treat them. As we'll see, we have different strategies for treating the methane-producing bacteria or archaea versus the hydrogen. So I really want people to treat if they can. If somebody is like 85% better after we start treating them for a little while, I typically will say, all right, you can skip retesting. Angelica, giving you lots of options because we want to think about, right, what's going on with our patient, and if we can address a couple of things with the herb, then we want to do that. You know, not just give them an herb that can kill the SIBO, but like maybe an herb that also suits their energetics. Is it warming? Is it cooling? Do they also have more diarrhea or constipation? What if you think there's a biofilm? And biofilms are like this slimy coat bacteria can make over the top of themselves that make it more difficult to detect them and much more difficult to treat. Different types of neurotrophics can be supportive in supporting the migrating motor complex. Lion's mane, gotu kola, the berberine-containing herbs again, and acetyl L-carnitine.